Hello everyone, today we are going to discuss the blood supply of heart. Blood supply of heart is divided into two parts. One is the arterial supply of the heart and next one is the venous drainage of the heart. We will discuss each one of them in detail. So let's start with the topic. So here you can see the heart, and first of all the main question is what is the main vessel which is giving blood supply to the heart? It is the aorta. As aorta is the main vessel which is supplying all your body, so is the heart. Aorta is supplying all the muscles of the heart, and how aorta is giving blood supply to the heart we will discuss here. Heart is supplied by coronary arteries. From aorta, coronary arteries are emerging. What are coronary arteries? Coronary arteries are the arteries which are emerging from these coronary sinus. What are these? These are coronary sinus. अब coronary arteries का origination coronary sinus है, but coronary artery originates from coronary sinus or aortic sinus. It's right. Sinus are formed from cusp of aortic valve. The main question is coronary sinus को कौन form करता है? Your coronary sinus is formed by the cusp of aortic valve. This is what is forming your coronary sinus. Here you can see the valves of aorta, that's a aortic valve, and these are the cusp of aortic valve. So these are three in number, 1, 2, 3. इनमें से एक आपका नॉन कोरोनरी साइनस होगा जिसको हम नीचे डिस्कस करेंगे, and two of them are coronary sinus. The two coronary sinus are left coronary sinus and left and right coronary sinus, and out of three, one is non-coronary sinus. So what is the meaning of non-coronary sinus? Non-coronary sinus is that sinus which is not giving either right coronary artery nor neither right coronary artery nor left coronary artery. So this is your non-coronary sinus. Coronary sinus are present in ascending part of aorta. We have already discussed this is the aorta and it is just the ascending part or the beginning of aorta, and it will later form the arch of aorta and continues as the descending thoracic aorta. So in the ascending part of aorta we are seeing the coronary sinus, and I told you that coronary sinus are formed by the cusp of aortic valve. Aorta is divided into three sinus. We have already discussed 1, 2 and 3. We will discuss in detail in the next topic. This is the diagram which will help you to understand in detail, and it will clear your concept. So here this is the diagram I have designed, I have made for you. Non-coronary sinus, I already told you the sinus which is not giving right coronary artery or left coronary artery. It is known as non-coronary sinus. So aorta is divided into three sinuses, left, right, and one is anterior right. Right coronary sinus is this one, left coronary sinus is this one, and the sinus which is not giving any artery is non-coronary sinus. This is the posterior side and this is the anterior side. It's the transverse section of the heart, aorta, and it's the transverse section of your heart, and this is your aorta. This is the transverse section of your aorta. यहाँ पर आप देखेंगे कि इसको मैंने बड़ा करके यहाँ दिखाया है. This is magnified here, and we will discuss here also. You can see this artery which is coming out from the left coronary sinus. This is your left coronary sinus. This is your left side, this is your right side, and this is your posterior side, and this is your anterior side. This is your pulmonary trunk and this is your aorta, and in aorta you can easily see all the all the sinuses, and out of them two coronary sinus are there, that is left coronary sinus and right coronary sinus. Left coronary sinus is giving origin to left coronary artery, and right coronary sinus is giving origin to right coronary artery, and this one is your non-coronary sinus. So what is this running? You can see here it is your right coronary artery and this is your left coronary artery. and this is your coronary sinus. This we will discuss in venous drainage. Okay, so we discussed about the coronary arteries, we discussed about how the coronary sinuses are formed, or more precise you can say these are all our sinuses, and out of them two are coronary sinuses, that is left and right coronary sinus, which are giving supply, which are giving origin to right coronary artery and left coronary artery, and one is your non-coronary sinus because it is not giving any artery. So this is what we have to study in coronary sinus and the coronary artery. So next one is your right coronary artery. We have already discussed that there are two coronary arteries which are supplying the wall of muscle. इनमें से एक है आपकी right coronary artery और एक है आपकी left coronary artery, right or left coronary artery. We will discuss about both the arteries in detail. So let's start with the right coronary arteries. अब right coronary artery के अंदर सबसे पहली चीज originates from right coronary sinus. We have already discussed this topic. We discussed about coronary sinus, and there we see that right coronary artery आपका right coronary sinus से आ रही थी. So is this clear? You can also see here, what are these? These are your sinuses. This is your aorta. So in aorta we can see three sinuses, and this is one artery coming from, this is the right side and this is the left side, and artery which is coming from the right coronary sinus is your right coronary artery. So is this clear? This is your right coronary artery. So we will discuss this artery in next slide. Yeah, first of all we have to study about the course of right coronary artery. So we already discussed that it's originate from right coronary sinus, then it passes or descends between right auricle and pulmonary trunk. Where is your right auricle? This is your right auricle, and ये रहा आपका pulmonary trunk, or this one is your aorta, great artery, that is aorta. So it is between right auricle and pulmonary trunk, right? This one, your pulmonary trunk and your right auricle, it is between pulmonary trunk and right auricle. Next is goes between the right atrium and the right ventricle. Where is your right ventricle? This hole is your right ventricle, is it clear? And this is your right atrium. As you all know that right auricle is a part of right atrium, so right atrium is there and right auricle is there. So it is passing between the right ventricle and right atrium. Right atrium and right ventricle. Next is, it runs in right anterior atrioventricular groove. Where is your atrioventricular groove? The groove which is present between ventricle and atria is your atrioventricular groove, and now your artery is running in the right atrioventricular groove on its anterior aspect. Here you can see your artery is running on the anterior side of your heart, and next it winds around inferior border. It winds around your inferior border. What is the winding of right coronary artery? Here you can see this is taking a turn on the inferior border. We already discussed yesterday or in the previous class about the external feature of heart, in which I told you this is the inferior border of heart. From the opening of IVC to the apex of heart, this is your inferior border. So right coronary artery is winding around your inferior border, and it is running in the right posterior AV groove. This is also your right AV groove, and that's also your right AV groove. What is the difference between these two grooves? This groove is on the anterior aspect and that groove is on the posterior aspect. Here you can see this is running on the posterior side of the heart. This is your right coronary artery running like this, and it is continuing here. Okay, So it reach the crux of the heart. We discussed in the previous video that what is the crux of the heart. Crux of the heart is the point, meeting point of three structures. One is your interatrial septum, next is your interventricular septum, and next is the atrioventricular septum. These three structure meets at a point which is known as the crux of the heart, and this is the crux of your heart. So right coronary artery is reaching your crux of the heart, and then it continues as posterior interventricular artery. हमें पहले ही पता है कि जो ये सरफेस है वो एंटीरियर सरफेस है, एंड द सरफेस विच इज बिहाइंड इट विल बी पोस्टीरियर. सो इसका नाम पड़ गया पोस्टीरियर interventricular artery, PIVA, which is very important artery which we will discuss later. So it anastomoses with circumflex artery, which is the branch of left coronary artery. This we will discuss when we will be discussing about left coronary artery. So in the course of, let's summarize the course of right coronary artery. So right coronary artery was originating from your right coronary sinus. Then it is moving in between the right auricle and your pulmonary trunk. Then it goes between your right atria and right ventricle. Right atria and right ventricle. Then it runs in the anterior atrioventricular groove. Then it winds around your inferior border, and it goes on the posterior aspect of the heart on the right side, but it's now posterior atrioventricular groove. Posterior atrioventricular groove. Then it goes to your crux of the heart, and finally it anastomoses with circumflex artery at the crux of the heart and continues as posterior interventricular artery in the posterior interventricular septa. Interventricular groove. Posterior interventricular groove. There will be a posterior interventricular groove which is on the posterior aspect. So this is the course of right coronary artery. Next we will see the branches of right coronary artery. So these are the following branches of right coronary artery. We will discuss them, and we will be visualizing them here in the diagram. Okay. So the thing is that the first one is right conus artery. You have to learn that it supplies infundibulum of the right ventricle. We will discuss what is infundibulum in the interior of the heart or internal features of heart. Right now just know that it supplies the infundibulum of right ventricle. Where is the right conus artery? Let's see. Your right conus artery. This is your infundibulum, and this artery you can see is your right conus artery. So right conus artery supplying infundibulum of the right ventricle. Next is your SA nodal artery, sinoatrial nodal artery. So the artery, sinoatrial artery, is this. The artery you can see which is going in between the aorta and your auricle. Aorta and your auricle, it is going and supplying your SA node. Supplying your SA node, it is SA nodal artery. The next one is right marginal artery, which is also known as acute marginal artery. Very, very important, because we will discuss later there is also an obtuse marginal artery. So keep in mind it's acute marginal artery which reach up to the apex. So let's see where is your acute marginal artery. Right or acute marginal artery. This is your artery which you can see this is the apex of heart. So it is reaching to the apex of the heart. So right marginal artery or acute marginal artery is reaching up to the apex of your heart. Is it clear? Okay, acute marginal artery. Next is right side anterior ventricular rami. Right side anterior ventricular rami. This is the right side anterior ventricular rami. Right side anterior ventricular rami is supplying the anterior surface or sternocostal surface of your right ventricle. So just this is your right side anterior surface of right ventricle. The next one is your posterior interventricular artery. The most important artery is posterior interventricular artery, because it is the major artery that is the continuation of right coronary artery. You can see it's a right coronary artery. It's giving some branches. One is your for infundibulum, that is conus artery. One is for SA nodal artery, and यहाँ पर आपकी acute marginal artery एंड यहाँ पर आपको दी है फॉर वेंट्रिकल. So your right coronary artery is continuing on the posterior aspect, and finally it continues as your posterior interventricular artery. So it is the continuation of right coronary artery. So posterior interventricular artery is the continuation of right coronary artery. It runs in posterior interventricular groove. It's present in posterior interventricular groove. Next one is anastomose with anterior interventricular artery. Anterior interventricular artery is a branch of left coronary artery. We will discuss it in left coronary artery. So left coronary artery, let me show you. It gives a branch that is the anterior interventricular artery. From here, it's your anterior interventricular artery on the anterior surface or anterior aspect of the heart, and it anastomoses with the posterior interventricular artery. So posterior interventricular artery anastomoses with anterior interventricular artery. Posterior interventricular artery is a branch of right coronary artery, and Iota is a branch of left coronary artery. Okay, the next thing is it sometimes originates from left coronary artery. Posterior interventricular artery sometimes take origin from left coronary artery, and that is known as left dominance. Just keep it in mind that sometimes it take origin from left coronary artery. We will discuss the dominance in further slide. Okay. The next thing is it supplies diaphragmatic surface of left and right ventricle. This artery is going on the posterior aspect. You can see that posterior interventricular artery is present on posterior interventricular groove, which is present on the diaphragmatic surface of the heart. So it will definitely supply the diaphragmatic surface of your heart. Is this clear? Supplies diaphragmatic surface of the left and right ventricle, that is your diaphragmatic surface. Next one and the last one is your septal branch. It is very important branch because it is supplying two structures, that is AV node, and the next one is your IV septum. Your posterior interventricular artery is supplying your AV node. AV node is present on the junction of, we will discuss it later when we will be studying about the interior of the heart. Just let me tell you, it's present near here. Okay, so it is supplied by posterior interventricular artery, and posterior interventricular artery is also supplying posterior 1/3. This number is very important for the numericals. This number is very important for the numerical. Posterior 1/3 of interventricular septum and AV nodes. So these are the branches of right coronary arteries. Right coronary artery, AC nodal artery. Next is right marginal artery, also known as acute marginal artery. Right side ventricular artery or REMI. We supply the anterior surface of right ventricle. Posterior interventricular artery, which is further giving some branches, which is a further important artery, and it is supplying interventricular septum, posterior 1/3 of the interventricular septum and AV node. And it originates from left coronary artery sometimes, which is a case of left dominance, which we will discuss in later slides. Runs in posterior interventricular groove, and sometimes supplies diaphragmatic surface of the left and right ventricle. Okay, so this is about the branches of right coronary artery, and with this we completed the right coronary artery. We discussed about the course, and then we discussed about its branches. The next one is the left coronary artery. So the first and the most important question striking in your mind is from where left coronary artery is originating. You can see it originates from left coronary sinus. We have already discussed about it in detail. So let's see in image, this image. This is your left coronary sinus. Okay, this is your left coronary sinus, which is giving origin to your left coronary artery. Okay, so let's move to the next slide. Yeah, this is the course of left coronary artery. Let me add one thing, that left coronary artery is greater than right coronary artery, but left coronary artery is smaller than right coronary artery. What is this? Am I correct or not? Okay, let me show you. So what is this? Left coronary artery is a very short or a small artery. Okay, left coronary artery is a short artery and it's dividing into terminal branches, but right coronary artery is a long artery which is continuing as posterior interventricular artery. But left coronary artery का diameter right coronary artery से ज़्यादा होता है. So left coronary artery is greater in diameter than right coronary artery, लेकिन left coronary artery is shorter than right coronary artery because left coronary artery divide हो जाती है आपका circumflex branch and your anterior interventricular branch, which is also known as LADA, left anterior descending branch. So it runs between pulmonary trunk and left auricle. So in the course, this is your left auricle and this is your pulmonary trunk. Okay, pulmonary trunk and left auricle. So this artery is originating from left coronary sinus and then it is running in between pulmonary trunk and your left ventricle. Then it gives two branches, that is anterior interventricular artery and circumflex artery. This we will discuss in further slide. This is your anterior interventricular artery and this is your circumflex branch. So what I am trying to say is that the left coronary artery is just this one, this is small, because it is branching into terminal branches, so it is shorter than right coronary artery, but it is greater in diameter than right coronary artery. Let's move to the next slide. It's about anterior interventricular artery. I told you in previous slide that left coronary artery की दो terminal branches होती हैं, anterior interventricular artery and the next one is circumflex artery. So in this slide we are discussing only the anterior interventricular artery, which is also an important artery. The other name for anterior interventricular artery is LAD, left anterior descending artery. Let me write it here. Left anterior descending artery. Okay, is this fine? So it is present in anterior interventricular groove. Here we can see that this will be your anterior interventricular groove and this is your anterior interventricular artery or IVA, and it is present in your anterior interventricular groove. The next is accompanied by great cardiac vein. There is the one vein which is running in this manner. Okay, this we will discuss in further slide in detail. This is known as great cardiac vein. So great cardiac vein, it is accompanied by great cardiac vein. Next one is it winds around the inferior border to anastomose with piva. Here you can see it is this is the inferior border. I already discussed about inferior border. It is running to the apex. So till here it is your apex and till here it's your inferior border. So anterior interventricular artery is winding around your inferior border to anastomose with posterior interventricular artery, which is the branch of right coronary artery. So this is the anastomose with posterior interventricular artery. Next one is a septal branch. This anterior interventricular artery will be giving some septal branches, that is perforating interventricular septal branches. This is not one artery which is coming from anterior interventricular artery, but there are more than one small arteries, so they are known as septal branches, which supplies anterior 2/3 of interventricular septum. We just discussed in posterior interventricular artery ki it is supplied by your posterior interventricular artery supplying your posterior 1/3, but it is the anterior 2/3 of interventricular septa. आपका anterior interventricular 2/3 of interventricular septum is supplied by your septal branch, which is the branch of anterior interventricular artery, which is the branch of left coronary artery. तो आपका एंटीरियर 2/3 ऑफ सेप्टा सप्लाई करेगी आपकी लेफ्ट कोरोनरी आर्टरी, जबकि आपकी राइट कोरोनरी आर्टरी जो कि ब्रांच देगी पोस्टीरियर इंटरवेंट्रिकुलर आर्टरी, जो कि सप्लाई करेगी आपकी पोस्टीरियर 1/3 ऑफ योर इंटरवेंट्रिकुलर सेप्टा. This is the point to be noted. Okay. The next thing is diagonal branch. Let's see where is your diagonal branch. This is your diagonal branch, and this was your septal branch. This is your diagonal branch, and diagonal branch is supplying the anterior and lateral surfaces of the left ventricle. Okay. This you need to remember. This will be your anterior surface or your sternocostal surface, and this is also the left surface because it is facing towards the mediastinal surface of your left lung. So it is also your left surface. So it is supplying the anterior, left also, but and the lateral surface of your left ventricle. This is the left surface or lateral surface of your left ventricle and also sternocostal surface. So this is your ventricular rami. Ventricular rami, it's supplying your sternocostal surface of right and left ventricle. There will be a one branch which is known as ventricular rami, which will be supplying your right and left ventricular surface of right and left ventricle. So let's move to the next slide. Next slide is the circumflex artery. Okay, circumflex artery is also a terminal branch of your left coronary artery. This is a circumflex branch which is taking origin from your left coronary artery. It is descending between the left auricle and left ventricle. This is your left auricle and this is your left ventricle. So it is descending in between left auricle and left ventricle. It winds around the left border. It is taking a turn, it is winding around the left border. This will be your left border. It is passing in the posterior part of atrioventricular sulcus. Yeah, here will be your anterior atrioventricular sulcus, but on the posterior aspect there will be posterior atrioventricular sulcus. So circumflex branch, after taking a turn, it is running in the posterior part of atrioventricular sulcus. Then it reaches to the crux of the heart to anastomose with the right coronary artery branches. So we just discussed that right coronary artery is coming from here and it goes on the posterior aspect and it anastomose with your circumflex branch at the crux of your heart. Where is the crux? There is the crux of the heart on the posterior aspect of the heart, where there will be anastomosing of right coronary artery and the circumflex branch, which is the branch of left coronary artery. So next one is the branches to left atrium and left ventricle. While it is taking a turn, it is giving certain branches to your left ventricle and left atrium, which is present above your atrioventricular sulcus. So it is supplying left atrium and left ventricle. The next thing is left marginal artery or obtuse artery. Very, very important, because we just discussed acute artery, acute marginal artery, but here it is left marginal artery. It reaches to apex. This is your left or obtuse marginal artery, and there will be one acute marginal artery. Acute marginal artery is the branch of right coronary artery, but obtuse marginal artery is the branch of left coronary artery. So they anastomose at the apex of your heart. So this is what is written here: left marginal artery and obtuse artery reach up to the apex and anastomose with your right marginal artery. So this is the circumflex artery. And the next one is about dominance. Yeah. What is the meaning of dominance? Dominance is decided by your posterior interventricular artery. If posterior interventricular artery is taking origin from the right coronary artery, then it will be right dominance. अगर वो आपका left coronary artery से आता है, then it will be your left dominance. So in majority we get to see that right posterior interventricular artery is taking origin from your right coronary artery, but sometimes we can also see that posterior interventricular artery is taking origin from left coronary artery, and then it will be the case of left coronary dominance, and which is not a good sign or prognosis. Why? Left coronary dominance is not a good sign of or bad, it's not a good prognosis. Why? Because we just discussed that left coronary artery is giving a branch that is anterior interventricular artery, which was supplying the anterior part of your septa, but posterior interventricular artery is supplying the posterior part of interventricular septa. If posterior interventricular artery is also coming from your left coronary artery, so any blockage to left coronary artery will lead to the damage of your interventricular septa. So it is not a good prognosis, or it is not a good sign. So this is what we have to study in left coronary dominance. The next is right coronary dominance. Posterior interventricular artery is from right coronary artery, which is commonly seen. The last one is balanced coronary dominance. Posterior interventricular artery is arising from both right and left coronary artery. So this is what we have to study in the dominance. Next, let's move to the next slide. Yeah, next and the last topic is the venous drainage of the heart. We just completed the arterial supply of the heart. Now we have to study how the heart is drained. What is the venous drainage of heart? So the first and the most important thing is by coronary sinus. Heart is drained by your coronary sinus. The next thing is, where is your coronary sinus for the venous drainage? It begins at left part of atrioventricular sulcus. We can see it here. This is first of all, this is the posterior aspect. This is the posterior view. Okay, so don't get confused. This is the posterior view, and this is your coronary sinus. So coronary sinus, it is starting from on the anterior aspect on the left side. This is the left side. On the left side of atrioventricular sulcus, it is present on the anterior aspect of atrioventricular groove on the left side. Then it is winding around your left border, and that it is present in the posterior part of atrioventricular sulcus. So it is starting from anterior surface and it is going like this. Okay, it opens into posterior smooth part of the right atrium. So we know that every vein which is carrying deoxygenated blood, it is opening into your right atrium. So your coronary sinus is also opening your right atrium, but it is opening in the posterior part, which is the smooth part. This we will discuss in the interior features of heart or internal features of heart. The next and the last most important thing is guarded by Thebesian valve. Thebesian valve is this is your coronary sinus, and it is opening into your right atrium, and it is guarded by your Thebesian valve. So this is what we have to study in the venous drainage of heart. Next, we need to see the tributaries of this coronary sinus. We just discussed that venous drainage is done by your coronary sinus, but what are these? These are the tributaries of your coronary sinus. So now we will be discussing about the tributaries of the coronary sinus. The first tributary is great cardiac vein. Great cardiac vein, which is accompanied by anterior interventricular artery or the circumflex artery. This is your great cardiac vein, and this is your anterior interventricular artery, and this is the circumflex branch of left coronary artery. Circumflex branch and anterior interventricular branch, both are the branches of left coronary artery. So next one is the middle cardiac vein. Middle cardiac vein is accompanied by posterior interventricular artery. This is the posterior view of your heart, and this will be your posterior interventricular artery. The vein which is running with posterior interventricular artery will be your middle cardiac vein. Okay, this will be your middle cardiac vein. The next one is your small cardiac vein, which is accompanied by right coronary artery. This is your small cardiac vein, which is accompanied by right coronary artery. Here you can see this is your right coronary artery, which is giving some major branch, that is the right marginal branch. So this is your small cardiac vein, accompanied by right coronary artery. The next one is your right marginal vein. Right marginal vein, it continues as a small cardiac vein. As its name suggests, this is your right marginal vein. Right marginal vein is accompanied by your right marginal artery, and it is continuing as your small cardiac vein. This is your right marginal vein, which is continuing as your small cardiac vein. So the next one is the posterior vein of left ventricle. On the posterior aspect, we can see the posterior vein of the left ventricle. This is the vein which is draining the majority of your left ventricle. So this is your posterior vein of left ventricle, which is draining into your coronary sinus. The last one is oblique vein of left atrium, which is also known as vein of Marshall. Okay, oblique vein of left atrium. This is your oblique vein of left atrium, which is finally draining into your coronary sinus. So this is all about the tributaries of coronary sinus. First is a great cardiac vein, next is the middle cardiac vein, next is small cardiac vein, next is right marginal vein, next is oblique vein of left atrium, and last one is the posterior vein of left ventricle. So this is about the tributaries of your coronary sinus. So this is the end of the topic. So today we discussed about the blood supply of the heart. In blood supply of the heart, we discussed two topics. First is your arterial supply, the next one is the venous drainage. In arterial supply, we discussed about the coronary sinus, how a coronary sinus is formed. Coronary sinus are formed in your in the ascending part of aorta by the aortic valves, in the cusp of your aortic valve. Next, we discussed about your right coronary artery and left coronary artery. In right coronary artery, we discussed about its course and its branches. In left coronary artery, we discussed about the course and its branches. One thing is left in your left coronary artery. You need to add that left coronary artery giving one branch, that is the anterior interventricular artery, which is also known as left anterior descending artery, is more prone for blockage, that is atherosclerosis. So left coronary artery is more prone to your blockage. Okay, this is about the coronary arteries. Next, we discussed about the right dominance, left dominance, and balanced dominance. That is the dominance of the heart, which is decided by your posterior interventricular artery. And in the end, we discussed about the venous drainage of the heart. Venous drainage of the heart is mainly by the coronary sinus, and in coronary sinus the blood is drained by your tributaries. We discussed about each tributaries and the arteries which are accompanying them. So this is all about the blood supply of your heart, and with this we just complete this topic. So thank you for watching, and please subscribe my channel. Thank you.